An angry scene at a hospital in Shanghai last week after the death of a patient with a serious kidney disorder. The patient had been in a critical condition. Doctors decided a specific imported medicine was needed. Hours later, the patient died. Family members trashed the intensive care unit and attacked the doctors.
They caught me in the chest, threw my glasses away and asked me to kneel down for the patient. When I refused, they beat me.
In another incident on Monday, 3 doctors in southern Guangdong province were beaten by family members of an elderly patient who died that morning. One doctor suffered injuries to his kidney, spleen, face, and left eye.
I think the risks and the misunderstandings are making our working environment very tough. Medical staff are frightened already.
According to the latest data, 7 people died and 28 were injured in hospital violence in China last year. The victims include doctors, patients, and a security guard. And hospital violence is on the rise. A normal Chinese hospital can expect an average of around 27 attacks on medical staff each year. That's an increase from just over 20 in 2008. In response to the rising number of attacks, new guidelines have been issued by the National Health and Family Planning Commission in conjunction with the Ministry of Public Security. The guidelines call for hospitals to have at least 1 security guard for every 33 medical staff or every 20 beds. Hospitals are also being asked to install security scanners, security doors, and high-tech alarms. But they must also improve their mechanisms for handling complaints. 2 hospitals in Beijing declined to speak to us on camera, but they did tell us the guidelines, despite of their good intentions, may be hard to implement. Just meeting the new requirements will mean hospitals have to radically raise their own spending budgets, and that will only mean one thing: a rise in the cost of health care.